Hi, so this is a short video that will outline some of the basic points to do with the Twin Peaks theory, which relates to pain, pain perception, pain tolerance. And as you can see, the Twin Peaks, the actual name of it, sort of relates to how, if you were to depict this as a graph or in this slide as an image of two peaks, where our levels of pain perception actually become perceived, if you like, based on certain scenarios, and these perceptions tend to be a very complex relationship between physiological, and also some sort of social interactions to do with our experience and how we understand pain. So it's generally broken down into threat perception, and then there's normal tissue tolerance levels for pain, and then the new tissue tolerance levels, and then I'll go into very briefly potentially some things that we can do to reduce pain. So threat perception is influenced by a number of things, and it's not only the tissue damage, so the physical damage that's been inflicted upon the tissue, which is perceived through various types of nerve endings. It's also the brain's assessment of the threats to the body, which can be also like a visual thing as well. So if you've ever experienced having a cut but you didn't know it was there till you seen the blood, that sort of thing, and the brain will then evaluate this sort of interplay of different signals between the body and the environment to sort of come up with what it determines as the level of potential harm that could come to your body at that particular time. So initially we'll be looking at the peak on the left, where your brain will perceive a threat and take actions to try and protect against that threat, but then in certain instances that's not possible. You're caught off guard, or something happens that you have no control over, and that is when you go into the tissue tolerance threshold, for where the body and the brain starts to physically perceive that pain. That, as you can see from the peak on the left, is generally before the normal tissue tolerance levels are generally higher before an injury, because you don't have the previous sort of the memories of an event, which will then play into your perceived levels of pain later on down the line. So yeah, normal tissue tolerance, it's different for everybody, and can vary on a number of things. So just based on who you are, like genetics, how your nerves work, how far your nerve endings are away from your brain, stuff like that, and past experiences, that's a big one. Like a paper cut might hurt more the second time, because even though it's not necessarily a painful or particularly damaging incident, it's one of those things that sort of gets in your mind, and you're like, you want to try and avoid that. And the sensitization mechanism, so what has actually caused that particular injury, and whereabouts on the body are you physically sensing that. And then hyperalgesia, so you have got an enhanced, you might have an enhanced sensation of pain, so increased sensitivity. This is a situation where your nervous system will make pain feel significantly worse than some other people might experience it as, and that again is influenced by similar sort of things. It could be a genetic thing. You could be under a particular amount of stress, so you generally feel that your senses are heightened across all of your senses, or you may have previously experienced a similar situation that has created an injury or pain in the past. So then your brain sort of jumps to sort of like a higher pain experience, as a way of trying to defend yourself from going through that experience again. So once something like that has happened, you then have this new tissue tolerance. So your body then becomes less tolerant. The pain threshold is reduced based on the similar experiences. That could be biological things. So that particular area of your body could be generally more sensitive now, just as a function of inflammatory response, or your nervous system might, those nerve endings might become hypersensitive. Psychological. So put back in that scenario, you suddenly have heightened stress levels, more anxious. You start reliving those experiences again, or generally, you could just be in a particular frame of mind where you can't necessarily deal with pain so well. So that sort of feeds back into mood disorders. And then there is a social impact. So, are things good at home? Are you in a position mentally where you can deal with physical stress on the body? Are you happy at home, at work? All those sorts of things can also have an effect on your ability to deal with pain, which is essentially response to a large amount of physical stress on the body. So that new tissue tolerance post-injury tends to be reduced. So in conclusion, reducing pain, how can we go about this? It's a multimodal approach. We need to use lots of different methods. Analgesia, specific to the kind of pain that's being described. So is it musculoskeletal? Is it nerve pain? Is it neuropathic? And then lots of different holistic therapies, behavioral therapy, physiotherapy, desensitization, mindfulness, meditation, anything that can help reduce stress, particularly stress that would relate to experiences related to the injury, and then the reduced pain threshold. And then obviously just generally being happy at home, being more comfortable in your life, and that's all going to feed into feeling more comfortable and less painful. So in conclusion, understanding the Twin Peaks theory of pain and considering the multifaceted nature of pain perception is essential for creating these comprehensive strategies for pain management and trying to revert back to the normal tissue tolerance levels of pain that were there post-injury.